Good afternoon. I'd like to call this special meeting of the Wilson County Board of Education for Wednesday, September 30th, 2020 to order. Members of the board, I'll need to have an approval of the agenda.
Madam Chair,
Mrs. Powell,
I move that we approve the agenda for September 30th, 2020 special meeting of the Wilson County Board of Education.
is there a second?
Second.
It has been moved by Mrs. Powell, seconded by Mr. Mercer, that the agenda for the special meeting of the Wilson County Board of Education for Wednesday, September 30th, 2020 be approved. Is there any discussion? Hearing none, please cast your vote. Mrs. Barnes?
Aye.
Mrs. Boyette?
Aye.
Mr. Breen?
Aye.
Mr. Farmer?
Aye.
Mr. Mercer? Mrs. Powell?
Aye.
And myself, Dr. Fitch, aye. Let the record reflect that the motion carries unanimously. Please join me in the Pledge of Allegiance to be followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Members of the board, we have for presentation today the Wilson County Schools 2020-2021 Reentry Plan. As we have lived through COVID and the Plan C configuration for our students, when we made the approval at the beginning of the year, we voted to be in Plan C until the end of the first grading period. And as we have approached this ending of the grading period, Dr. Mills and staff have been hard at work trying to make sure we are able to do what is possible in keeping with the governor's dictates for school opening. So I'm going to turn this over to technical difficulties. I'm going to turn this over to Dr. Mills for whatever comments he has to make, and then we will proceed. Dr. Mills?
Madam Chair, board members, we have a full house of folks here, either in the boardroom or online, from principals and some other staff members. What we want to share with you today is just the overview of the work that's been done by all staff here, and lots of input from principals. We've got feedback from parents, feedback from teachers. And we want to walk you through kind of an overview of some of the pieces and parts of reentry, from some of the child nutrition, transportation, cleaning, as well as the options that you have available to you for the various plans as the governor's laid out for A, B, and C, and explain what those are again and narrow it down. We're doing by level, elementary, middle, and high, just with providing some of the data as we go. And at the end, we've got several options for the board to consider that would work based on what the data says from our folks, what we're able to manage logistically with transportation and other components. And at that point, we can have a discussion. We also have Teresa Ellen from the health department on the call today. And so we got some information in our presentation that we can show regarding incidents of COVID in our county and elsewhere. So it's just kind of a longer presentation to get to some of the options, but we feel it's important to remind everyone some of the pieces and parts as we go. Okay?
Okay, thank you.
So what I'm going to do is share my screen. some of this go away. There, a little bit forward. Okay. And so Dr. Wilson, Dr. Williams, Dr. Parker's remote, Mr. Letchworth, and others, we're available to answer questions as we go, but we're all just going to kind of tag team. So as people come on the call, we'll ask them to identify themselves at least to start with. You can see
Okay.
some of those folks.
All right.
Okay. So for today, again, as I mentioned, the overview, we want to walk through elementary, middle, and high schools, give some information about safe environments, transportation and school nutrition. Mr. Harvey and Ms. Talton are on the call as well. We're going to go through the staff input piece when we surveyed staff members about decisions to come back and approaches to that. And then we have the prioritizations and the options, and that's feedback that you've given over time as well.
On page 3, you see the guiding principles that we discussed in the July board meeting, and they remain the same. And so that's just a reminder of what we are working towards. And then on page 4 is a reminder as well about the 3 different plans that the governor has shared with us in DPI. We are currently in Plan C, where we have the remote learning, the virtual academy option, as well as paper pencil. Then the governor came back and said that we could go into Plan B. That's part of the discussion for today, as well as in Plan A. There was a little bit of a change from our July meeting. Originally, it was like at 50%, and now in Plan B, the term is used limited density. On page 5, it talks about, we shared what the governor's announcement happened to be on the September 17th, which leads us to today. And then we also shared the 4 bullets of some of the documents that we use to help guide us through this plan.
Before you go any further, since you changed and you added limited density, can you
Yes.
explain that terminology so that those that may be listening and to the presentation can understand where that difference is?
Originally, the number was 50%, but there are locations to where 50% may not work. And so when the DPI document that we received said limited density, that could be 50%, that could be 60%. It's whatever is the limited density, as long as you keep within the 6 feet separating of the social density.
Okay. Thank you.
And then on slide 6, this is just the information to the board to let you know about what our goal was to get input from our families. The week that we surveyed our families, the September 21st through the 25th, the format that we used was we provided a Google form to our teachers, and in that Google form, we had a script for them to share to give them some background knowledge, as well as what the process happens to be. And if, as the teacher was calling the parents, then they could complete the form so that the information was given back to us in real time throughout the week. We did have interpretation services available for those families who needed it. So on slide 7, this is an overview of the number of responses, and that first number you see is the number of responses we received out of the number of responses, and the second number in that list, how many students we have in that particular level, and then the percentage. So you can see the percent of students that, or families that responded at each of those levels.
I think that's a really good return rate for a school
I
district.
do too.
I mean, I really, that was something I was very concerned about. to get input. I think that the fact that our teachers went the extra mile to do that for families and to make those contacts, that was a lot of work on their behalf. And I thank them for doing that. That was huge. But I think it made a huge difference in terms of us getting feedback that we could actually use to determine options and for the board to consider. It made a huge difference. I mean, that's massive.
And if you can recall offhand, what was the response rate when we did the surveys initially?
Oh, I have to pull it up. I've got numbers in my head. And
Okay.
It was around 60%, I think.
It wasn't this high.
Mhm.
It was still pretty good.
Mhm.
But typically you'd see around 30-something% for a
Right.
survey like this.
Okay.
And that was part of our goal, is that we wanted 100%. And that was the reason that we chose that format. We know that that took a lot of time for our teachers, but we wanted as many.
So they really stepped up to do this, but that really does help the data be more representative of our district.
Correct.
Madam Chair,
Yes,
may we give the teachers just a round of applause
Absolutely.
for all
Good with
their
that.
effort?
absolutely. Thank you.
They did.
I'm sure they had phone ear by the time they were done.
And for every parent that they did not were able to reach via phone on that Thursday morning, then emails were sent out to those families if they were unable to reach them. So, and we did have a few, not as many, but we did have a few responses that way.
Okay.
And
So-
Madam Chair,
Mrs. Powell?
and one note is this was done in 4 days, probably day and night.
Yes.
It was.
So,
There's
yeah,
a lot to
I
do.
definitely commend them for doing that. That was fantastic.
So then we go to our section for elementary, and on slide 9, it just is a reminder, and we just separate it out by each level to remember what each level responses and their rate of response happens to be. And then we move into slide 10, and this is broken down by grade level in the elementary level, and we had several questions on the survey. These are just a few because we also surveyed them regarding transportation and such as that. But for example, in the column that says Plan A, we ask parents about were they for their students to participate in Plan A. So you see the number by those grade levels as well as the percentage. And then in Plan B, and then we also asked, because we felt that some parents were either way, we wanted to know what their feelings were, that they would be okay with either plan. And that's why you see that column that says either Plan A or B. And then we asked the question about for parents who were not interested in either Plan A nor B. And so we did make sure that we were very clear in our script for the teachers to share with parents, is that if they chose Plan A nor B, neither one of those, then those students would transition to the virtual academy.
Dr. Wilson,
Yes, sir.
would that be for the remainder of the year, or could it, at a point, could they decide, yes, I do want to enter into the adopted plan?
Well, we've been consistent in saying at least to the remainder of the course. And for elementary school, the remainder of the course would be the year. The reason so is because right now, our remote learning students and our virtual academy students are following the same pacing guide, just because of the way things turned out in July with just how the decisions were made. But if we go back into face-to-face at any point, then there's a possibility that those pacing guides are going to be a little bit different. So students who are in a virtual academy may not be on the same pace. So it could be very cumbersome for students to move back and forth. However, if for some reason a student did have to, we would we would look at that student, just like we would have a student who would transfer from outside of a school district to inside of a school district. They might be off of a different pacing guide, but it's certainly not the preferred.
Well, and I understand that because with the planning that it takes to have multiple things, but what I was thinking was there are some, I'm sure there's a part of the people that say, I don't think I would like plan A or B. But once they see it in place
Yeah.
and see how it works, they may say, man, I believe I would prefer that. And I'm not suggesting that we even do that. And I'm not suggesting that we, matter of fact, if we were to offer anything or allow anything, I would think it should be relatively soon after we enter into the plan, as opposed to having it all through the year. I have a deadline. If you decide, I like what I see, I believe I'd like for my child to be there.
You're right. You're exactly right. The sooner the better. We did have discussion that if something did come up, then if there's any time a transition needs to happen, as you well know, sometimes those transitions are easier at the end of the marking period. So that, again, that's something that we had considered.
Dr. Wilson, this is Velma Barnes. I have a question. In your survey to parents, was there any discussion concerning parents' ability to go back to work or lack thereof if the plan was not, if the plan selected is not Plan A?
No, ma'am, we did not ask parents about their working situation. Is that what you asked? The
Yes,
parents'
I have
job?
questions from parents concerning that, so.
Yeah.
Madam Chairman,
Mr. Farmer?
this is from a, let's see, I've got a bunch of questions that came in from teachers and parents. This, I think, was from a parent. If a student signs up face-to-face but does not attend in person on a particular day, but is in attendance virtually, are they considered present?
That would have to be something that we would need to be discussing. Back to the question that Mr. Mercer asked, they are going to be on most likely a different pacing. And currently, one of the benefits that our students have now in the remote learning and in the virtual academy, then those students who are in the virtual academy now can log in and watch a video of the teacher teaching live or synchronously. That is not going to be an option when we go to face-to-face and a virtual academy kind of situation. Because think about, I'm teaching a class of 15, 30 students, whichever plan we go with, and there's maybe some students that are over here on the other side that are a virtual academy, these 5 or these 10 or 15. I can't be teaching in a synchronous or a live instruction with the current setup that we have. That's what, before the meeting, I was talking to Mr. Robertson about what could be some of those possibilities.
Does that get to your
And
point?
the other one was, it came, and I think she answered this, if a student chooses a face-to-face, fills out the appropriate form, but like it happened in Georgia, all of a sudden that child feels totally unsafe and wants to go home, can that child go home and do virtual learning?
Well, just as always, anytime that a student is having some difficulty, we look at, even when prior to COVID, we would look at those individual student needs. And that would be a team at the school level who knows those students personally, individually, to make those kind of decisions. But certainly if a student is not being successful in a particular place, then we would want to have that student to be moved into a more successful plan or a more successful delivery option.
All right, this is a real question. It's kind of off the wall, but still, it's a real question. Is there ever a such thing again as a snow day? Because now we are virtual across the board, and if it snows, we can just go to virtual. And, or is that sort of simple?
I'll take that one. I will never complain about weather again. Okay? And I've said that out loud to principals and everyone else. There are other counties that have used virtual learning days for inclement weather. And I would suggest we have that conversation long after we have this one about what we can do. But we could certainly have the ability to roll out remote learning days on inclement weather when we have them. Frankly, I look forward to dealing with that a whole lot more than some of the logistics of this issue. So, yeah, that's what the mountain districts have been doing for a while. And that's some of the feedback we've gotten as we planned is how they've rolled some things up for some of their virtual days.
Well, as we set our calendar earlier, and we already built in those required remote learning days. So are you saying that there would be flexibility as to when the remote learning days might possibly occur?
In terms of snow days?
Yeah.
Yeah, well, yes, we could do that. I think that's going to be the new norm, period. Yeah.
Okay.
Thank you.
Sure. So, questions on this one?
Any other questions regarding this slide?
And the thing to keep in mind is the pattern of the information.
Yeah, when you look at the total elementary, for example, you see that in Plan A, 19.2%, but if you take that particular row and then the row that says either Plan A or B, you could add those together to see about, because those families could be put together. And the same could be true for Plan B, as well as that column that says either Plan A or B. So overall, based on the survey, we have around 24% of our families at the elementary level said that they were not interested in their students returning in Plan A nor B.
Okay.
In slide 11, we have information that we collected from our elementary staff. We have 441 elementary instructional staff. We did not survey the custodians, cafeteria workers, bus drivers. It was the instructional staff. 441 said yes, 43 with accommodations. And Dr. Parker is the one who gets that information for the accommodations. 14 of those instructional staff said no. It's important to note that 5 of those are classroom teachers. So out of the grand total of 498, 5 were the classroom teachers that had said that they were unable to return in either Plan A or B. And the question that we asked them was based on with students. We didn't specify Plan A or B, but we were saying with students.
Madam Chairman.
I'm sorry.
I'm going to go with Ms. Barnes first and then Mr. Farmer.
My question was of Dr. Wilson. We refer to accommodations. Does that mean those teachers with immune deficiencies and those that have that are high risk?
I can take that question if you like.
There you go.
So Ms. Barnes, everybody who wants a temporary accommodation, they fill out the appropriate paperwork. We review their medical documentation. And it's one thing to keep in mind as we make that decision, we have to understand that the job duties of different roles differ with different plans. For example, with teachers Plan C, with teachers not being in the building, children not being in the building, those job duties are a little bit different than if we move to another plan. So yes, to answer your question, if someone's considered high risk by a medical professional, we do take that in consideration.
Okay, thank you.
Ms. Barnes, this is
Yes.
Brandon. The only other thing I would add there is just because someone has requested accommodations doesn't necessarily mean that they'll be entitled to them. One of the things that Dr. Parker and Dr. Mills, Dr. Wilson, Dr. Williams have been looking at is the requested accommodation and giving the necessary job duties of the individual and what they have to do for the school district. Especially, I think that's one of the reasons it's very important that district stayed in their survey to return with students, because there are certain obligations of instructional staff returning with students that cannot be done without the person being present. They're some of the essential functions of their job. So.
Thank you.
Mr. Farmer?
She was reading my mind. That's exactly what I was going to ask, but I was just going to add my 2 cents. On September the 13th, I think we all, or maybe we didn't, but I got an impassioned plea from a Donald Dudley from Hunt High School, an ag teacher who is a board certified teacher and been teacher of the year and teacher of the region. And he has asthma and he is so very, very scared, but he loves teaching and he don't want to give up teaching, but he's got a family and he's got small children. And we don't want to lose teachers like this. And I understand there's an exodus of great teachers. So I hope we will really work with these teachers, especially the teachers of such high quality here.
In those instances, would those persons be given an option of the virtual academy?
We have tried to do that when we can. The issue is matching people with
What's needed?
subject specialty, licensure, and availability. The first time out for virtual academy, we didn't get much interest, quite honestly. And it has grown some, but it's not been as popular as some might think for folks to agree to do it. It is a lot of work. And teachers are slammed already with everything else. And so it's extra work on top of the work the teachers are already doing. So it was hard to recruit folks for that first round. It's gotten a little bit better.
Yeah.
Okay.
Yeah, it makes a huge difference in how many students are at that school, because we wouldn't want to have a teacher also that would have, like, if there are only 10 students for virtual academy, and then the rest of the students in those grade levels, those teachers are overloaded in their classes. So, I mean, that would be good for the virtual academy that would have, say, 10 students in that class, but then that could possibly overload the other classes. So what we currently have going on is that the teacher is teaching the remote learning students as well as the virtual academy students. And then, of course, if there are students in their class who require the paper pencil option, then they're providing support for those students as well.
Okay.
Madam Chairman,
Mr. Farmer?
now that we're talking about staff members, I'd like to ask a couple of questions that some staff members have asked me. If a staff member has a positive case, will they need to take their own leave time?
Mr. Farmer, I'll take that one. No, sir. As long as they are under a order from the county health director to quarantine, they will be under contagious disease leave under the state benefits manual. In the event they are self-quarantining under medical orders and not under an order of the county health director, they could qualify for emergency paid sick leave under a federal program for the 2-week period. So, and that's full pay for an individual who's quarantined.
Well, another member asked me if they're quarantined due to exposure, but they feel okay, can they still work remotely at home?
Yeah, we've had people do that.
Mhm.
So you wouldn't have to worry about paying them unnecessarily. They still would be working and contributing.
I think the issue that, we've had some folks do that throughout. I think the issue that the board needs to consider is as these things happen, and they inevitably will, is, if we're in school, then coverage of classrooms. I mean, that's really the difference in the conversation today versus last time, is as we go back into whatever option, then that's a conversation piece, which we've got information to share with you about substitutes and other pieces and parts. So yes, they could do that.
Thank you.
Ready? On page 12, we did a table to let you know about what each plan would look like at the elementary level. So for Plan C, let's start with that because that's where we currently are. And you see what the options for teaching and learning are. And you also see the time. And then the rest of the items there are listed as in A because we just didn't need to use those. In Plan B, to the left of that, the teaching and learning options would be face-to-face 2 times a week and remote learning 3 times a week for pre-K through 5, the virtual academy for K-5, and then the paper pencil for pre-K through 5. And then we have over in Plan A, the face-to-face 4 times a week and the remote learning 1 time a week for pre-K through 5, and then the virtual academy for K-5, and then the paper pencil for pre-K through 5. You'll notice that the pre-K is not listed as far as in the virtual academy because they would be the students who would be coming in. Then we talk about the classroom capacity, and then Plan A would be up to 100%, and then limited density. And that's where we talked about that, not necessarily a number, but being able to keep those students and the individuals, the adults, with the students at 6 feet apart. Then the bus capacity, same thing with the limited density. And I think right now, Mr. Harvey is saying that for the Plan B would be 22, and that's on another slide that we'll cover in just a few moments. You see the social distancing based on the governor's or executive orders. In Plan B, social distancing is required. However, it's recommended but not required in Plan A. Face coverings are required in both. Bus monitors are recommended and not required in both plans, A and B. And then the entry screenings are required. You will note that the time of the school day is a little bit different in Plan A and B as compared to, number one, what was currently the schedule prior to COVID, as well as the plan that's in Plan C. And that has a lot to do with students coming on campus and the arrival times, the dismissal times, whether it's in a carpool or a bus. If we're sharing buses, we're going to need to make sure that there's enough time that buses at the elementary level can get over to the middle school and so forth. And it's important to note that we would need to have additional supervision at the carpool and the bus just for the screenings.
Madam Chair,
Mrs. Boyer?
Dr. Wilson, Dr. Mills, while we were sitting here, I just received some information that DHHS has changed from 6 feet to 3 feet as the social distancing. Have we received that information?
Madam Chair, Johnson County received that information and they've implemented 3 feet too, and it's not been well received by the teachers.
We just got something from the governor about phase 3. That was the last email I got right before we started.
Okay, well, we just wanted to make you aware of that. It shouldn't change any of this, but it might
It would,
make some
it wouldn't
things
change any of the
easier.
options you've got. It would just
Right.
change how difficult at least one of the options would be. I mean, it's, that's a whole lot different at the last minute than some of the other ones, but, the same options would be on the table for you to consider. We can go through with what we're doing today. Yep.
It changes the meaning of density, doesn't it?
Yes, it does.
Mhm.
Limited density just got cut in half.
Especially on a bus.
Yeah. That's gonna be a lot different for that one. So I don't have it in my email yet. And I'm sharing my screen, so I'm not gonna try and dig through it.
Okay, that's fine.
And when I blow
But-
something up, I'll knock the whole meeting offline, so then that'll be really popular. So I'll wait and check.
Madam Chair,
Mr. McPherson?
I'm looking at DHHS's website, and the toolkit that actually has the regulations for which the school district has to follow has not been modified since September 17th. So the social distancing requirement, as far as I know, hasn't changed.
Unless it just changed at 2:00 when the governor had his briefing.
It didn't change at that point because there was no announcement, there was no executive order,
Okay.
or no regulatory action to dictate such.
Thank you.
But we can go to movies, bars. and
Yeah, you
nightclubs.
can go to bars and movie theaters.
That is exactly right.
So,
I don't think our children would be eligible
No,
to enter the establishment, so that.
Well, the
that's
movie
not-
theater.
movies, they.
Movie theaters, but not the bars.
Madam Chair, I have a question for Dr. Wilson.
Yes, ma'am.
When she was describing the teaching and learning under Plan A and B, the face-to-face 4 times a week and remote learning 1 time a week, is that 1 time a week allowing us to be able to clean the building? Is that why the 1 day for remote learning is there? I know in some of the plans, I looked in the options that talk about cleaning of the building on Wednesdays if we did the 2 groupings.
Yes, ma'am, that is correct. That is definitely one item that we would need to take care of during those days, would be the deep cleaning, as well as on the instructional side would be that our teachers would be faced with working with the students face-to-face and that delivery option, as well as a delivery option of remote learning or virtual academy, an online option, and to provide teachers time to plan lessons for both very different delivery options. Whereas, I mean, they're spending an exorbitant amount of time now, but the remote learning and the virtual academy are very similar in platforms, not identical, but similar. But moving students from a face-to-face and a virtual academy are 2 very different platforms. And so based on some of the feedback that we've received from our instructional staff across the district, that would be the best option.
Okay, thank you.
Okay.
So then we move into the middle school reentry section.
And the middle and high school sections are identical in terms of format to the elementary section, so it's going to follow the same process.
Okay.
So those are the number of responses as a reminder.
And Mr. Sage sent me a text that the previous survey that you asked about, Dr. Fitch, the response rate was 54%. So we've gone from 54 to 77, so that is a huge improvement.
A big jump. Thank you.
So very similar to the, like Dr. Mills said, we tried to follow the same format in all 3 levels. And so the question was asked for the middle school as well as the high school about how they wanted their students to return when it came to Plan B or C and stay in Plan C. We did not ask our middle school families about Plan A because it was not on the table based on the governor's orders. So that was not even a question that we asked them. So you'll see the results there from the Plan B, and you've got the raw number as well as the percentile. So 64% of our families who were surveyed wanted their students to go into Plan B. at the middle school level. Then the next slide talks about for our teachers or our instructional staff. We did have the same question for them at the middle school level. We did have 19 middle school instructional staff who stated that they did not, would not be interested in coming back, did not feel comfortable. They were not able physically, health-wise, to come back with the with students. And 10 of those are classroom teachers across all of our middle schools.
Dr. Wilson,
Yes, sir.
the grand total doesn't add up. Is there some other students?
It's only 100,
It's 197
197.
instead of
There-
two.
There were 3 people that Mr. Sage shared with me that they had been unable to reach
Okay.
for that they were on like leave already. So they were unable to reach those. Thanks for pointing that out. I didn't say that. He did tell me that and I forgot to say it. So then the next slide talks about, again, that same table. And again, the Plan A is off the table, so we just put NA down there. We're currently in Plan C. And Plan B, what it would look like for the middle school, it would be very much like what is in Plan B for the elementary, in the fact of that it would be 2 days face-to-face and 3 days remote. And then our virtual academy would be an option, as well as the paper pencil. And then, so then you see the information there about the capacity, the social distancing, the face coverings, the bus monitors, and the screenings. The time that you see at the bottom is a little bit different from the elementary, because you may remember I said that we needed to have some kind of staggered time with the buses.
Right.
So the elementary was from 8 to 2:30,
Mhm.
and the middle would be from 9 to 3:30, in case buses are shared between if middle school is in Plan B and elementary is in Plan B. We did talk with Mr. Harvey, and he stated that based on the number of students who had shared that they would be needing the bus, that they could make that happen, that turnaround in that route. So then for our high school reentry, on page 19, again, is a reminder about our responses, and they were really good at the high school level. That is great. Then on page 20, we have information about the survey for our families. We did place the 12th and the 13th together because we do have some students at that 13th level at the early college. So we just kind of clumped them all together. And we have 64% of those families had said that they wanted their students to go back in Plan B. The board had voted that they would be in Plan C for the remainder of the course at the end of the semester. But we also wanted to share with you what the parents were saying as well. On page 21 is information about our instructional staff at the high school level. And we had 24 that they had some kind of difficulty in returning with the students. And 23 of those are classroom teachers at the high school level. On page 22, we have something, it's very similar to the middle school, what you see. The only information that we don't have there is the length of the day. And we decided that we would just put TBD or to be determined based on if the board had decided to do that that we would have to, if the board decided to go with elementary, middle, high, then that's going to make a difference in that start time. Because again, those buses are shared.
Now, currently, at the high school, in Plan C, the instructional, the classes start at 9:30 as opposed to 9 o'clock. They're doing A day, B day, and they run till 2:30. So the hours would change on Plan C now?
No, that also incorporates, the class may start at 9:30, but that also incorporates some time for those students between 9 o'clock and 3 o'clock that they would be doing some asynchronous learning. Some of our students are seeing that they're only looking at the time that for instruction is what they're logging in. But in reality, it's that whole time frame because they should be working synchronously, live, asynchronously recorded as well.
Okay.
Then we move into our safe environment.
Mr. Farmer?
I've got two questions here from teachers, if you would, please, about masks and face coverings. If a student refuses to wear a mask, and this probably would only happen in the middle school and the high school, is a teacher allowed to tell them they cannot enter the room? Will it be possible for a student to actually get in our room without a mask on? And are there going to be administrators present to the entrances to monitor and ensure that all students are wearing masks or will get one upon entry? And will that be consistent in all the schools?
Dr. Mills, would you like me to share?
Sure.
Mr. Farmer, just to speak to the issue of masks, masks are not optional. We are required to have them for staff, students, and all visitors who enter the building. Our guidance, of course, from DHHS and also what we are abiding by with the executive order mandates that we have those on. In terms of supervision, I know that school administrators, principals, teachers, staffs within the schools do a tremendous job supervising students at arrival and dismissal, class changes on a regular basis, just in general. Those same procedures would be in place as we are monitoring students as they come in, as they leave for the day, as they transition, although the transitions may be minor, there may not be many of them. And in the event that a mask needs to be provided, just to speak to that, in my section coming up, Mr. Farmer, I'll address the face coverings, and that is one of the things that we address is that if a staff, student, or visitor to campus does not have a face covering, we will be providing one to them upon arrival.
The other question will probably be addressed too is, you got hard heads. That's just a fact of life. What should we do if a student takes off their mask in the room and that's not to eat or drink? Do we tell the student to leave the room, or how do we address the improper mask wearing?
I think there's going to be a lot of questions like that are best handled with our administrators in the buildings. And we can handle that with staff and faculty meetings as well. Some of these questions are very pertinent, and we've had the conversations about them, but we're getting into disciplinary matters, and I think we can handle those administratively with questions and answer sessions with faculties and such versus trying to answer these on the fly. And here, it's probably going to take us down a pathway where we might not want to go.
Okay.
Does that make sense? I think they're valid questions, and we've already talked about both of those questions and others, but I wouldn't want to get into a lot of those questions in the meeting today. And I would encourage teachers to send them to us or to their principal. We've been handling those as they come up because it is going to happen. There's no doubt. It will. But we can handle that.
But as long as it's consistent in all the
I agree.
schools, there won't be any problems.
I agree. That has to be done.
Mr. Mercer?
Thank you, ma'am. Not asking for it to be discussed or decisions made, but the wearing mask had entered my mind because I see people in public. So many have it with their nose exposed and they're wearing a mask, but they aren't wearing it properly. And and that's something that I agree needs to be handled so it can be handled consistently because Either you're wearing it properly or you're not wearing it, in my opinion.
It's the same as not wearing one.
So we're at slide 23, and that is where Dr. Williams will start sharing.
Thank you, Dr. Wilson. Madam Chair, members of the board, we have some information that we'll provide in the next 3 sections from the Administrative Services team. And the first will be under safe environments. This information does not have a tremendous amount of changes from when we met originally. But I will go over the information that we do have for you here tonight. I wanted to go ahead and make note that, as Dr. Mills has stated at the beginning of the meeting, we have Teresa Ellen from the Health Department. I believe that Miss Angela Manning is also with Miss Ellen. And just wanted to publicly state how much we appreciate the partnership that we have with our health department. We, myself and Mr. Mark Lethwich, we probably speak with them on a daily basis, I'm certain. And they are tremendous to work with and have been a great help to us. To that point, we did add in this presentation the COVID-19 dashboard from Wilson County, from the health department. And this is live data that is, I don't want to misspeak, the data that is on here is up to date. We've been monitoring and following this and felt that it was, appropriate to add it to this presentation here today as well. Dr. Mills, I didn't know if you wanted to go to it or if
The board would like to see it.
Yes.
Okay. See if it's going to update automatically. Probably not. Hold on.
While you try to transition to that dashboard, you see in the news where the numbers of students who are have been COVID exposed or who have COVID-19 is on the rise nationwide. Are our numbers in Wilson County in keeping with those national numbers, Ms. Ellen?
Muted. There you go.
Sorry, I'm trying to unmute.
You're unmuted now. Thank you.
Okay, thank you. No, right now, I pulled statistics. If you look at our 0 to 17, it's at 10% of our total positives. When you break that down for school age, which is not on this dashboard, but we did a little extra data mining today. 5-year-olds to 17-year-olds is only 8% of total positives. And if you break that down to 5 to 10-year-olds for your K through 5, it's only 2.5% of our total number of positives. So we are not seeing a significant increase in that age group. And I can tell you when the State Department of Public Health has presented their data to us, they stated that they surveyed the counties who went back in Plan B.
Okay.
And they have not seen any increases in their numbers of school age positives either.
Okay, thank you.
While Dr. Mills is transitioning back, just another note in terms of tracking for COVID with Wilson County school staff. We track that in a dashboard that we've created. We'll have one for students as well when students return. And this document is shared with the health department, and every case that we have, we contact the health department and work through each individual case with the health department.
Now, because cases are, if my understanding is correct, because cases are tracked in the county that the person resides, and we have individuals who come into Wilson County schools, and now that the teachers are back in the school sites, it doesn't give us a true picture. I don't think possibly does not give us a true picture in terms of the numbers, because Ms. Ellen's data is going to track for Wilson County. But if a teacher is coming in from Johnston County or Wake County or somewhere else, that's not going to figure in our numbers for the county to be able to show a realistic picture. Is there any conversation between the different county health departments in notifications between those counties?
Yes, ma'am. And to speak to that, Dr. Fitch, for our tracking that we do within the school system, every positive case, whether they be an employee that works within Wilson County or outside of Wilson County, is documented.
Okay.
And then I'll go ahead and turn it over to Ms. Ellen for the next piece in regards to the communication between the health departments
Okay.
and what they do. But we do track every positive staff member that we have. Yes, ma'am.
All right.
And Dr. Fitch, yes, there is communication between health departments. If the person works in another county, they notify us. And we also connect anybody from another county to a cluster. So if we were to have a cluster within a school, we would know how many of those positives were Wilson and how many were from outside the county as well.
Okay, thank you.
Now, is a cluster 5 or more?
Yes, sir.
Thank you.
Moving forward with our next slide, our next few slides, we've broken this down into Plan A and Plan B in regards to social distancing and minimizing exposure. The main distinction that I wanted to make between Plan A and Plan B is that in Plan A, the social distancing requirements as they apply in Plan B are recommendations in Plan A. However, we do still have to denote these through signs and floor signs for a reminder for those in the building about social distancing, although it's not a requirement. So where you see these items under social distancing and minimum exposure for Plan A that relate to social distancing, these are for the purpose of reminders because they're not requirements, but we are still required under the DHHS toolkit to post those reminders. Some of the other items that I would mention, and you can see moving past the floor signs and the social distancing reminders that I've mentioned. Again, it gets back to monitoring, encouraging teachers and staff to monitor arrival and dismissal to discourage congregation. This is congregating. This was, again, getting back to the supervision piece. Choosing physical activities that limit the use of shared equipment, keeping close contact between students during these activities limited. So again, just monitoring things such as physical education or recess to promote and encourage the social distancing. Limiting the use of high touch areas. So for example, making sure that doors are open during times of high traffic, making sure that we have a limited touching of the same items within the classroom, things of that nature. So these are all part of A. If we transition to slide 27, with Plan B under social distancing and minimizing exposure, important to note that all the requirements that we identified in Plan A are still to be adhered to. In addition to that, under Plan B, we must limit the total number of students, teachers, and staff and visitors within the school building to the extent necessary to ensure the 6 feet distancing. So there again, I just want to make the distinction that it is recommended in Plan A, the social distancing is required in Plan B. Also, again, getting into the social distancing piece, you will see the words of making sure to limit, ensure. So instead of recommendation, it's a requirement for the social distancing component. On slide 28, again, it speaks to social distancing in outdoor settings where students and teachers and staff may be stationary, waiting in lines for transportation, sitting in groups, making certain that the classroom is arranged or identified in such a way that social distancing can be adhered to within the classroom. And it speaks to social distancing in the last bullet again, where the teachers and staff, students, where they could potentially congregate And so to be sure to ensure that social distancing takes place in those areas.
Now, when we got ready to go back to school, you all had provided us diagrams with student desk placements.
Yes, ma'am.
So those diagrams, examples that you provided us back in July are the seating arrangements that would occur.
Still would
going
apply in
back.
Plan B. Yes, ma'am. That's correct. So those pieces that we discussed originally in July, much of that, other than the Plan A implementation being recommended as opposed to required, are essentially the same.
Excuse me, Dr.
Yes, sir.
Williams.
Yes, sir.
And I tried to read all of this and I could have missed it, but limiting the touching of high traffic areas. In 4th and 5th grade, some schools have blocked in the past. Are we limiting the movement so that instead of students moving, maybe the teachers would change rooms?
Yes, sir. That was a strategy or implementation that we had looked at in July as well, as opposed to students moving, having teachers move in those occasions. And Dr. Wilson, was there anything
No, that's correct.
else on that? So,
Perfect.
yes, sir.
Madam Chairman,
Mr. Farmer,
I could wait to transportation, but I don't think it's covered there either. Past experience as a bus driver and not having any help, and I don't know if there will be monitors assigned to buses or not. When a bus arrived at a school, it was like a herd mentality that they all moved as a herd as they came into the building. Will that be monitored now so there's spacing and maybe single file, or how will that be approached?
Yes, sir, Mr. Farmer. It's going to be a necessity to do so because we will have to screen at the school. So since we will be screening at the schools, that process is going to have to be very structured and very ordered coming into the building to make sure that we do screen at the school.
Thank you, sir.
Yes, sir.
was it my understanding in July that before the students got on the bus, their temperature was taken so that once they got to school, they were able to go ahead and enter the school, which could result in that herding that was just talked about, because they really don't have to be screened. The other screening came at the the carpooling area where the students came in one by one. So there is that possibility for the herding effect that I think I'm hearing Mr. Farmer speak of, because those students would have already been screened when they got on the bus.
The change from in July to now is that the screeners will not be available to be on the bus. We don't have the personnel.
Okay.
When we were working with the numbers in July, our numbers were much higher on those that were saying they were not coming back into the building.
Okay.
We were trying to make plans based off of that. Those numbers have changed, and as a result, due to staffing and personnel, we don't have enough people to put monitors on the buses. That's not uncommon from other areas in what they're doing as well, because it is a staffing issue trying to run all the buses.
So the bus driver is not going to, as the students enter the bus, is not going to do a temperature check?
No, ma'am. And Mr. Harvey is on the call as well, if he can speak to some of his state calls. And we have that in our transportation section as well that we could go over. But we can speak to it now in terms of feedback that Mr. Harvey has gotten on some of the transportation calls.
Yes, sir. I'm sorry.
Go ahead, Mr. Harvey.
Mr. Harvey,
Yes, sir.
you know, one of our biggest contentions was in some of the guidelines that we talked about in July is the windows have got to be down all the time during the course of the trip, during rain, snow, cold, whatever. Has that changed any at all?
Yes, sir. That has changed as well. Through the conversations that I've been having on my weekly transportation calls with the state, you generally, as things change and progress, they've been moving the requirements to recommendations. So screening is no longer required. it is recommended if we have the available personnel to do so. And in the event we do not, what was communicated to me was that the best practice would be to load students on the bus and have them screened once they get to the school site. Because that also alleviates another issue of what to do with children who you screened and their temperatures were too high and leaving them at the bus stop. No one had a good answer with that. And with the way the numbers were trending, the state decided that they no longer had to have that as a requirement, and it could just be a recommendation if the personnel was available. And the same thing also goes for the windows being down. If the windows being down is not required, it is recommended if possible. In addition to that, the only thing that's required as far as windows being down is that they do remain down while the bus is being cleaned and sanitized.
Good.
I understand that state issue, but as the students come into our schools and our staff is screened as they enter, and the students who are coming in from carpool are coming into the school and approaching staff, but the bus driver who is moving all of those students has no in-between mechanism for themselves. All of the other staff are and I guess the bus driver's gonna take his own temperature,
I can cover the screening process for drivers.
his or her own temperature. But then when you've got these students coming on the bus, it exposes that bus driver where the other staff are not really exposed because they've been screened before the students come into the building.
Yep.
Is that going to be problematic for our bus drivers?
I did in fact ask that particular question, and what was communicated to me was that the thought was that when students get on the bus, that they will not be in close enough proximity to the driver for the, I guess, requisite amount of time for transmission, that should not be as much of an issue if students and the driver both have on face coverings, which are still required. So they do still have to wear face coverings if they are on a school bus. And that's one of the reasons that I was given to why it was no longer a requirement, but a recommendation. Because I tried to get the most clear answer I could as, is this required or is it recommended? Just so we would know what to do. And what was communicated to me was that it is a recommendation. If you don't have the personnel to provide monitors for all of your buses, then, you know, the best practice would be to have them screened at the school. And looking at the numbers of the personnel that we had, there was no way for us to have screeners for every bus without having to use classroom teachers. And that's just that just wasn't a good solution in my personal opinion.
Madam Chair,
Mr. Mercer,
may I ask Mr. Harvey a question?
certainly you may.
Mr. Harvey,
Yes, sir.
this is Henry Mercer. The procedure on the bus, it would make sense, and I'm sure if it comes to my mind, it's come to the mind of the smarter people, that students, as they got on, would go to the back to keep them separated, as opposed to being seated and people walking past them.
Yes, sir, that is correct.
Okay, thank you.
It may help that we've got that section later on,
Okay,
and a lot of those questions are being answered.
thank you.
I believe slide 29.
Yes, face coverings.
Dr. Mills? Got it. Slide 29 discusses face coverings. I know we have had some conversation about face coverings already, but let me just go ahead and cover a few things about face coverings. They are required. Face coverings are required for all staff, students, and visitors to campus. Did make some notes in regards to the requirements of face covering in the DHHS toolkit. We were provided a pack of 5 cloth face coverings from the state for every staff member and for every student. But in addition to those we have a additional supply of face covering. So any students or staff or visitors to campus that do not have one when they arrive will be provided one upon arriving on campus. If we go to slide 30. This discusses more about the face coverings. There's an executive order 163, which outlines when face coverings are not to be or are not required to be worn. For our purposes, essentially they are outlined in this executive order, but certainly when eating, it's not required to have the face covering on when eating. Face coverings will not be required during outdoor recess or physical education when the activities allow for social distancing. This is one of the things that is in the toolkit in regards to physical activity. And discussed this in a meeting with Ms. Ellen in the health department last week and let them know what our plan was in regards to this. One note to make is that schools are required to share guidelines with the teachers, staff, students, families on the proper use, wearing, and removal and cleaning of the cloth face coverings, which is what we received from the state. And there are websites available by which we'll do that. So our plan will be this information will obviously be available on websites. We'll make sure to get copies to parents who need it. But to speak to your point, Mr. Mercer, in regards to proper wear of the face mask, we'll make sure to get information out about how to properly wear the face mask and cleaning for the cloth ones as well, for those who have those.
Dr. Williams.
Yes, ma'am.
Could I make a point here? This is Velma Barnes.
Ms.
As
Barnes.
I was going through the North Carolina school kit, I found this very interesting. We talked about the plexiglass and the vinyl barriers, and it did suggest that there should not be a substitute for distancing. If masks are the mask should also be worn because it would make it a layered approach. Did you read that, and could you discuss that for a second?
Yes, ma'am. So just to speak to that, Ms. Barnes, that is exactly right. And Ms. Ellen, again, on the call, will support this statement as well, is that the key components are mask, the distancing, and the hand hygiene. Those are the things that are discussed and are throughout the toolkit. So yes, ma'am, to speak to that point, that is correct. Other items or other strategies that can be utilized are good, but not a substitute. That's correct. Up to and including, for example, face shields. Face shields are not face coverings. We had that discussion as well, contacting Ms. Ellen. They're not face coverings. Even with a face shield, the face mask has to be worn underneath the face shield.
Thank you.
Yes, ma'am. Okay. 31. 31, preventative measures. Again, these preventative measures are the same as we discussed in July. They discuss our cleaning procedures, high-touch areas, what will be utilized for cleaning routines for our custodial staff. The main component here, the main takeaway is that our custodians do a tremendous job, and they have a lot of work to do inside of the buildings. And I would like to also take just a moment to stop and thank them for what they've done, not only for in preparation of potential students coming back, but on the day-to-day activities that have taken place with staff being back in the building as well. And they've done a tremendous job of making sure those high-touch areas are taken care of and cleaned and disinfected. The last bullet, and Dr. Wilson spoke to this in her part of the presentation at the beginning, that in a scenario where a Wednesday would be a remote day, just wanted to make note of that day would be for the Monday, Tuesday, Thursday, and Friday would be the daily cleaning that would take place. Emphasis on additional cleaning in the high-touch areas with more thorough cleaning to take place on Wednesday. On the remote learning day, just to define that a little better. What our custodial staff is doing every single day is the cleaning that is the thorough cleaning. I mean, that is the high touch areas, that's the surfaces. They're doing that daily. That additional day allows for increase observations of bathrooms, things that they need to take care of as they have been attending to those high-touch areas, and to ensure, if there's no students in the building, that they can get into those classrooms as opposed to during a time where students are out or transitioning, that they have plenty of time to get in and spend time on those high-touch areas.
Excuse me, Dr. Williams.
Yes, sir.
Now, is there another deep cleaning or thorough cleaning after Friday's classes to prepare for the Monday group?
It would be the same process again with all the high-touch areas, all the surfaces. That actually is part of the regular routine. So those areas, when we refer to it to more thorough as opposed to deep, because when we have people out of the building, it allows for the custodial staff to be able to access areas easier and to be able to get in and ensure that they've got all the areas. But
Thank you.
yes, sir. Mhm.
Madam Chairman,
Mr. Farmer.
bullet 3 on 31, please. We're talking about hand sanitizers in children. As a dean of students and work with EC kids, we had children that were identified as huffers. And I looked it up and I didn't know if hand sanitizers would do irreparable damage to huffers, and I found out, yes, it would. Are these hand sanitizers going to be secured during the day, and will they be secured overnight? And will they always be secured by teachers?
Mr. Farmer, I would have two parts to that particular answer. From the health and medical aspects of what we are required to use now, Ms. Ellen, if you could speak to that in terms of the hand sanitizer, and then Mr. Letchworth, I'll let you talk to what we purchase and what we have on hand.
Can you unmute?
Excuse me, I'm muted.
Okay, you're unmuted, Ms. Ellen.
Could you repeat the question, please?
Yes, Ms. Ellen. Oh, I'm sorry. Go ahead, Mr. Farmer.
Basically, it's about huffers. And if you've not been in education, you may not know what that is. But some kids, especially EC kids or other kids also, they will take stuff and cram up their nose because of the alcohol content, even magic markers and so forth. And we have had to secure things like that in the past. And I was really concerned about this 60% alcohol in the hand sanitizers. And so I looked it up and see if that would cause damage to a child if he were addicted and were a huffer. And it said absolutely. Therefore, I want to know if these hand sanitizers will be secured and supervised rather than just be left in the hall around the bathroom or left on the teacher's desk, that kind of thing. That's all.
And to be honest with you, this is the first time I have heard anything about huffers. But I would think as long as the hand sanitizer is within supervision of a teacher, that it should be fine. In the bathrooms, I'm not sure, are y'all planning to use wall-mounted hand sanitizers?
Mr. Letchworth, I'll let you speak to what we have on hand, and then Mr. Farmer, I'll make sure to take care of the security issue of it.
Yeah, the wall-mounted ones, definitely it would not lead to huffing. But I think you could use the bottle sanitizers as long as it remains under the supervision of a teacher.
Well, this is not a slang term. If you'll Google this, it'll talk about it. We had to secure gas caps on cars. And if a child is identified as a hustler, it is a very serious situation.
Mr. Farmer,
Yes, sir.
just to kind of follow up on that question you had. So yes, when the health department does a walkthrough in our building every year, and we walk through and do trainings with staff members on the procedures that we have and the chemicals that are in the building. And actually myself and 2 other staff members at maintenance do walkthroughs. Any label that's on the back of a bottle that says keep out of reach of children, that is emphasized that that must be kept out of reach. That is part of the health department's inspection. That's part of DPI's inspection, and that's part of ours. And yes, that has been addressed at every training that we've had since we've had to introduce alcohol sanitizers back into our system, which we had removed at one time in order to meet the COVID requirement.
Great, Mark, great. I hope it filters down to the people that are actually working with the kids.
Moving into slide 32, monitoring for symptoms. This is getting into our screening processes and procedures. First bullet is that all staff, student, and visitors that are entering the building must be screened prior to entering the building. All staff that sign a screening question attestation form, and parents will complete a screening attestation form as well before students start back to school. And all visitors that arrive on campus also must answer the screening questions before entering the building. The student screenings will take place before, again, reiterating that the screenings take place before students, staff, and visitors enter into the building. We have some occasions where, or some areas where, if it is taking place directly outside of a building, there may not be a cover, an awning. So directly inside of that area, as we do here at the district office, would be how we would facilitate that as well. The staff, visitors, and students who have tested positive for or are showing COVID symptoms, have recently had contact with someone with COVID, must not enter the building, and that is a part of the screening process. So we would certainly, if they have answered, if yes is the answer to any of those questions, then they would not be able to enter that day. 33. Next is part of the screening process is daily temperature checks. And these will be conducted again for all staff and students and visitors to campus. The fever is measured as a temperature of 100.4 or greater. We have had an allotment of thermometers that have been distributed to the schools already, which was based on the ADM of the school. And we currently have 101 thermometers that are on hand that we will also be distributing to assist with the screening process and the checks as well, daily temp checks. And then, of course, staff and students would just need to be monitored, would need to monitor throughout the day. And for these are just some of the symptoms that could potentially display themselves. But at the end of the day, if we have a staff member or student and they are not feeling well, we need to monitor that so that we take appropriate action during the day for that. And that actually leads us into slide 34.
Before you go to slide 34.
Yes, ma'am.
Mr. Farmer, go ahead.
The thermometers that you have been allotted, are they the no-touch thermometers?
Yes, sir, Mr. Farmer, they are. These are the ones where you stand away from the person being screened and mash the button to get the temperature read.
I know I went to Lidl's this weekend because they had the same thing advertised, and when I got there and bought it, because I'm cheap and it wasn't but $19, and those no touches are about $50. When I got it home, you had to drag it across the top of your temple. So I was hoping that you had the no touch type.
Yes, sir. Ours work at approximately 2 to 5 inches away from the forehead, Mr. Farmer.
Thank you, sir.
Yes, sir. Yes, sir.
In your symptoms, because we may have some children who have asthma and the like, do they have to have notification in their chart so that because they may be experiencing an asthma attack, that they are not automatically assumed to be experiencing the COVID-19 symptom? It just may be, they had phys ed or they've done something that's exerting.
Yes, ma'am.
And all of a sudden they have an asthma attack. Are they excluded from the symptoms then in that circumstance?
Yes, ma'am, Dr. Fitch, that's a great point. We do need to make, and that's why it's critical that our students' medical information, if they have a medical action plan, a care plan, that those things, we have them current, we have them up to date so that we do know what medical conditions that our children may be having as they are there, so that we can, monitor for symptoms, but also make certain that we are identifying correctly what may be going on with the student that day. Asthma that you spoke of, for example, we come back from recess or PE. So being able to attend to that.
And let me address this temperature thing.
Yes, ma'am.
When I came in the building in preparation for the meeting, I sat in my car and the sun was on me. So when I walked in the building, my temperature when it was scanned was like 100.3, and I'm going, I don't have a fever. So we waited a second or two, and I was rescanned, and I was back down to 98 point whatever. But if we are mindful of the fact that sometimes if somebody has exerted and just come in, but I sat right in the back of the building, and the sun was beating down on me because I was on the phone and whatever, and my temperature was a misreading. So we have to be careful about the misreadings that can occur as well.
Yes, ma'am. And Mr. Lethbridge can speak to that as far as our training. When we conduct the training, that is a part of it, is that
Okay.
we would screen. If it is elevated, we can go to the side and then we screen again.
It only took a extra minute, and it was within the range, and it was like, I knew I did not have a fever, but it had registered. Okay.
Yes, ma'am. Absolutely.
All right. Thank you. 34.
34. Yes, ma'am. Signage is posted. We've had our signs and we've distributed those out to the schools. So we do have signs that are up that indicate if you're symptomatic not to enter the building. Space at the school must be designated for symptomatic individuals. This has been the case before. It was in July whenever we presented this information. And that is still the case. That particular space can't be utilized for anything else due to the fact that there's the potential and the possibility for someone who may be symptomatic going into that room. And it will have to be sanitized and clean once the day is concluded in preparation for the next day. If we have and we just put an individual, because this could be a staff member, it could be a student, it's anyone who's symptomatic. We need to make sure we at that point isolate the individual, identify what is going on, and then from there we need to get in touch with a parent or guardian if we've got elevated fever or whatever these signs and symptoms may be that we need to be monitoring. Now that was the other piece, Dr. Fitch, is a lot of times in communication with our parents, we can receive very valuable information as well about things. We ensure that the symptomatic students remained under a visual staff supervision with at least 6 feet distancing, and that supervising adult wear the gloves and the face covering. So all the proper PPE needs to be worn by the supervising adult as they are monitoring that student. On slide 35, speaks to the PPE and the preparations that need to be made whenever working with students or staff that may be suspected or presumed or symptomatic in some way. And these come directly out of the Strong Schools North Carolina Infectious Control and PPE guidelines. Again, this would be another opportunity that I would just interject the relationship that we have with our health department. And that, all of our processes, our procedures, they're certainly out of the toolkit. They're out of the documents that we have received, but we communicate routinely and regularly with our health department on our processes and procedures. This gets into where the guidance on handling suspected and presumptive cases and confirmed cases can be found. This is the link to the toolkit, but again, wanted to just make note that our health department is our most valuable resource, and they are the ones that we communicate with consistently. And this is also in regards to communication. I know that that has been a question or could be a question. What happens if we have a positive case in the school? Well, we've experienced that. I mean, we've had that as staff members have entered back in, not at a very high rate, but we've had some. And we have a communication for staff that's already been vetted by our health department. We work with them on that communication and we send that out. And we will do the same thing in regards to students as well. And that communication will be worked on with in collaboration with our health department. And then we can move into transportation. The first slide in transportation takes us through Plan A and what the requirements are under Plan A in transportation. Under Plan A, there are no requirements on the numbers of students that are allowed on the bus. It is a requirement to ensure that all students and staff wear a face covering when they're on the bus. It's a requirement that we clean and disinfect the transportation vehicles regularly, and that children must not be present when the vehicle is being cleaned. Mr. Harvey mentioned this a little while ago, that while cleaning, we have to make sure that we have no students on the bus and that the windows are down and that the doors are open while we're cleaning. On slide 38, under Plan A, screen students when we arrive to the school. I'll reiterate this again in Plan B. Screen students when we arrive to the school. Screen drivers before they begin their routes. Just to speak to that a little bit more in depth in terms of how will drivers be screened before they start their routes. Our initial plan going in to Plan A or Plan B when we are screening drivers is that the drivers will screen themselves prior to getting on the buses. We utilize this with custodians already. So, I mean, we typically have a custodian that arrives before everyone else to open up the building. The guidance that we've been given is that they can self-screen as soon as someone gets there that's on their team or is able to do so. They would screen them to verify their screening. We would utilize that same process. So the drivers would screen each other before they got on the bus. If the bus is leaving from the bus garage, then that will be handled at the bus garage by Transportation Services. They'll handle the screenings from there. We've also made note that although we have this process in place and that we plan to implement this process, it's going to be very important that we assess this process and we modify it once we're able to develop the routes. So once we know the ridership and we're able to develop routes, then we'll know the times of buses leaving and we'll know when they're going to be arriving to certain locations. So therefore, if there's a situation where a bus may be leaving or they may be loading as a driver and leaving prior to someone coming, then we need to make arrangements for that. And myself and Mr. Harvey have talked about potential solutions on how we can make sure they get screened, but they will be screened before they drive the bus.
Will all buses be leaving from the bus garage on a daily basis,
No,
or
ma'am.
they'll be back to the
Their school.
normal distribution and they take the buses to the schools and whatever?
Yes, ma'am. The buses, the schools that they park at and leave and arrive at, they'll be back there.
Okay,
And the ones who have been leaving from the bus garage will still do that as well.
okay.
Again, it makes note if a student becomes sick during the day, they must not use transportation to go home. And that we need to ensure that there's a transportation plans for any student that could not arrive. We would do that. If not even under these circumstances. You know, we're going to make certain that our students, you know, get home safely. You know, especially if they can't ride the bus. And again, providing hand sanitizer for our drivers. On slide 39. This discusses transportation under Plan B. And under Plan B, schools are required to adhere to all the requirements that we went over in Plan A, as well as the ones below. No more than one passenger can be seated on a bus with consideration for family members to share a seat. This is not a change from when we spoke last time about transportation. That's the same. Again, we talked about bus capacity in a Plan B. The capacity of the bus is 22 students as passengers. There can be no more than 2 passengers that can be seated in the driver's education vehicle or a contracted vehicle. This is straight from the toolkit, but an example of that is, you know, occasionally we do contract transportation with our EC, and that there can be no more than 2 there as well. On slide 40, matching up our transportation along with the potential plans that have been discussed at the first part of the presentation. These are some numbers in terms of drivers and capacities and how many drivers and buses it would take to run a variety of different types of runs under certain plans. So for example, under a plan elementary under B, middle in C, and C, it would take 85, it would be 85 drivers. 85 would do a single run, and we would not have to do any double runs under that particular scenario. Under an elementary Plan A, middle C, and a high C, 50 we would need 50 to run the elementary route, and I made the Plan B is where I was making the 85 under a single run. So I misspoke. I was talking about B instead of A under the first one. And under an elementary A, B, or C, 50 to 70 approximately to be able to run the elementary and the middle routes. And under that particular plan, transportation-wise, our plan would be to run single routes for elementary and then to identify any additional buses that would be available to be able to help run middle school routes. Our goal would be always to alleviate as many double runs as possible. That would be our goal. We would need to make certain that we have numbers so we could run the routes, but that would be our goal, is to try to alleviate that. However, there are certain options that we would not have any way of getting around it. We would have to do the double routes. So anytime you decrease the capacity of the bus, we've got to run more routes to get students. And the more levels that we have that we're running double routes for, or that we are transporting, increases the number of double routes that we have to do because there's less buses available to us to be able to utilize on other routes. Slide 41. School nutrition.
Madam Chairman,
Mr. Farmer?
I know this is transportation, but there are more modes of transportation other than just buses. I had a parent call me and said if we decided to go to face-to-face in the high school, would he still have to buy a parking pass if he drove to school? And if so, would it be full cost or would it be reduced because they're starting the year later? Hello?
I think everybody's trying to
Everybody's
figure
thinking.
out who's going to answer that question.
I lost contact.
If and
That was
when
fine with me too.
if and when the board decides about high schools coming back, that would be something we could discuss. We could certainly prorate things and do that. I just think once you see some of the options, that's going to be very difficult to do.
Thank you.
Madam Chair.
Mrs. Powell?
Yes, just a thought here, Dr. Williams. If a child does become sick on the bus or becomes sick in the classroom, how are we notifying parents? Is there a procedure in place for that to allow them to be aware of the situation?
Yes, ma'am. We would utilize our process for contacting parents. We obviously make sure we've got the proper contact information for our parents. And in those situations, whether it be on the bus or whether it be inside the school, we would certainly follow our protocols that we would whenever we have sick students at school prior to COVID. We want to follow those same things, making sure that we're calling the house if there's an emergency contact in the event that we cannot contact the parent. So we've got to make sure we've got the good data coming in and that we've got all our numbers up to date. And then we've got all the contact information for parents and the emergency contacts ready whenever we get back. Yes, ma'am.
Because I know sometimes that can be a problem as far as trying to get in contact with the parents. And I want us to be transparent. So
Yes,
thank
ma'am.
you.
Mm-hmm. Our next slide is child nutrition, school nutrition, and the two options or the two plans, how lunches will be served under the two plans. Students will still, under Plan A, students will still receive their meals by walking through the cafeteria line. Meals will be consumed in the classroom. It says classroom cafeteria dining. Just be aware that when we begin transitioning to cafeteria dining, we're going to the classroom initially. That's how we're going to start that process. And then as we begin to move forward, we can take a look at going into the cafeteria with some social distancing and some other safety precautions. But in the classroom for eating, meals will be packaged in closed containers and in the same manner as our current meals. So they're going to be packaged as they are now. On Tuesdays, breakfast and lunch meals for Wednesdays for remote learning will be sent home. So if we have remote learning on Wednesday, then we're going to make sure to send a breakfast and a lunch home on Wednesday or for Wednesday. Under Plan B, All the meals are served and consumed during the on-campus day, and they will be delivered and served in the classroom. So the difference there is that with a Plan B with limited density, we'll be serving in the classroom. We'll be bringing meals to the classroom. All the meals, again, will be packaged in the closed containers as they are now. On the last day of the students' on-campus learning, the students will be provided 3 breakfast meals and 3 lunch meals for the academic week. So when they finish their last day of on face-to-face learning, they will receive meals for the next 3 days. And there's an example of that if a student comes on Monday or Tuesday, or if they come on Thursday or Friday. So that is.
Madam Chairman,
Mr. Farmer?
I want to say just a big WOW, wow, that's amazing. I really appreciate what y'all have done with meals. Thank you, sir.
Thank you, Mr. Farmer, and certainly Ms. Mary Catherine Touton and her staff and the work that they've done to continue our meal service, and not only continue our meal service, but make sure to come up and create and find ways for our students to be provided meals with our curbside pickup and then the delivery service that we are currently doing at our stops. Thanks, sir.
Dr. Williams,
Yes, ma'am.
this is Velma Barnes again. I really, as Mr. Farmer said, want to commend our workers because I go past Bill Barnes frequently. And yesterday when it was pouring down rain, there was a lady standing with an umbrella over her head with her sign saying lunches. And then they were, of course, under the shelter waiting to give them. And I've seen them go through different kind of weather conditions, the heat as well, just to make sure those meals are delivered. And we do owe them a big debt of gratitude. I'm sorry.
Thank you, Ms. Barnes. I appreciate that as well. Could not agree or echo those sentiments more. What our school nutrition staff has done and the work that they have put in to make sure our children get meals.
Let me ask you about your example, because you talk about a student who comes on campus Monday and Tuesday, and when they go home with meals for the remainder of the week. But for those students who are on campus only on Thursday and Friday, do they go home with the equivalent amount of meals because they won't come back again until the end of the following week?
Yes, ma'am. They do. Ms. Touton, can you confirm that is, I know the example was a Monday, Tuesday student, but the same applies to a Thursday, Friday, correct?
That's correct. If really any grouping of days that are decided upon, we'll make sure that they are sent home with a box. And I do just want to reiterate the fact that is one container. We're going to make every effort to ensure that it is in one container with a handle, especially for students trying to travel on buses. We want to make it as easy and feasible as possible for a student to take their meals home.
Thank you so much.
Yes, ma'am. Okay, that concludes that.
Well, he's going to have an extra seat to park his box of food in because of the distancing.
I'm sure that's almost like gold, and it could probably ride in their lap.
All right, Dr. Parker's going to share staff input.
All right.
Yes, so once again, it's really important to get staff input throughout this whole reentry process. So on slide 44, you're looking at our percent of responses per grade level. Really pleased that the level of response that we got from our staff members.
It was great.
Yes.
Mm-hmm. That's huge.
That is certainly commendable.
Yes.
Just short of total perfect response, 99.7%.
Is that the same 3 we couldn't get in touch
Yeah.
with?
That was it.
Yes, sir.
Yeah, that was it. This is really,
So-
our folks cared a lot to do this.
Yes, they did.
Next slide, 45.
Okay.
So 73 people applied for temporary accommodations related to COVID-related issues. And so what you see here is data that we have granted teleworking for teachers under Plan C. So as of right now, we have 10 teachers who are granted telework in elementary, 13 for middle, 13 for high, for a total of 36. And we also have 2 teacher assistants teleworking, and those are only in elementary. It's important to note, as we talked about earlier, if we move out of Plan C, that these plans will be reevaluated, and these people will be, I'll have to contact all of these people and reevaluate going forward, as the essential job duties of their jobs may change if another plan is chosen. The next response is instructional staff responses. Once again, broken down into elementary, middle, and high school. And this is what basically there were a 3-part question about yes, in terms of returning with students in the building, returning with students in the building with accommodations, and then those that feel like they didn't want to return to the building with students, if students were there. Next slide. This is one of the same breakdowns along grade level lines. It's important to note that, like I said before, elementary core teachers not planning, it's just 5. When 1 is already teaching for the virtual academy. So this is pretty much our breakdown in terms of a staff preference, in terms of returning. Substitutes. So a segue with teachers, not only were we considering, teachers who prefer not to be in the building, so we actually were proactive in contacting the substitutes. They were contacted both by via a phone survey conducted last Wednesday on the 23rd. 124 substitutes were contacted. Out of those 124, 61 answered the phone survey. 53 said yes and 8 said no. We contacted the remainder of those folks, and they've been coming in each and every day. So right now you see 87 responses total. Actually, as of right now, because we receive responses throughout the day, actually 96 total responses. 80 have responded that they are willing to go in and work with students, and 16 have responded that they weren't interested in working with students in the building. And then also, we're going to, after we collect those numbers as we go toward a date, if the board considers changing plans, we will definitely, we're currently working with Mr. Mayor, our tech facilitator, in terms of working on safety protocols, working on how to implement instructional technology, and trying to have a cleaner touchless onboarding process.
Madam Chair, this gets us to the part of the presentation we can walk through some of your priorities from
Okay,
previous meetings and then go through the options.
all right.
Okay. So in talking about priorities, some of the guiding principles that Dr. Wilson talked about earlier were about the safe learning environment and access to the curriculum. And then we considered the how-to piece of some of the protocols, the content pieces, and then one prioritization that the board indicated early on was pre-K through 5th grade for elementary students. So one thing that the board needs to be cognizant of is that if you prioritize one level of school, say elementary, middle, or high, if you prioritize any one level, it creates limitations for the other 2 levels because of issues with logistics of transportation or protocols or the requirements that we have. So whatever decision you make to be your focus, that you put priority on reentry, it limits the options that we have for the other 2 levels of school. Okay, so that it's hard to put that into a flow chart or anything else. Just understand your first choice sets up what happens to the other two levels and limits it, and we can talk through that. So, and Dr. Wilson and I can walk you through this graphic. Thanks to Mr. Mayo for showing us his design prowess. He really has a knack for it. We've been teasing him pretty hard all week. But option one is where the district is right now, which is Plan C and remote for all schools. And that option you're familiar with.
Yes.
Okay. Dr. Wilson, you want to do option two?
So in option two, we have the opportunity for our elementary schools to go into Plan A. Like Dr. Mills said, Mr. Mayo had designed a graphic to help explain that. That would be that all students in the elementary level would go 4 days a week, Monday, Tuesday, Thursday, Friday. And we would have those group of students in school for those parents who wish for their students to be in school. And then we would also have the option for the virtual academy. So for those parents who prefer their students to be at home, then there will also be that opportunity. We have designated that Wednesday would be, as you see on the diagram, the remote learning for the students. They would be doing asynchronous learning or any kind of recorded kind of assignment, so it would count as a part of their instructional day. The teachers would be doing professional learning, whether it's professional development, working in professional learning communities, and then our custodians would be working on the deep cleaning that's already been discussed. And then our middle and high schools would stay in Plan C. So the next option is option 3, and that would be where our elementary schools could be to where there would be 2 separate groups. And so because we've already used letters and numbers, we started to go into the colors. So that's why we have a green group and a blue group. So in the green group are the students who would go on Monday and Tuesday, and then on Thursday and Friday, they would be doing remote learning as well as that Wednesday before, because everybody is doing remote learning on the Wednesday. And then the opposite number of students, depending on how we split that up, because it may not be 50%. That was part of the discussion earlier, because we're going to have a group of students in virtual academy. So it's not that if a class of 30, there may be 10 of those students might be in virtual academy. So that's going to leave 20 students. And then 10 might be in the green group and then 10 in the blue group. So it's not necessarily out of a class of 30, 15 are going to be up here and then the other 15. And then the middle and the high school would stay in Plan C, where they would be in a remote learning setting.
Before I flip to the other option, I would like to point out that some of the logic behind 2 days and then a day of remote learning and the cleaning we talked about, and then another 2-day group. There are some systems that are looking at weeks on and weeks off. And we felt it was important for students to be back in the building every week. And that would reduce the amount of time students are away from instruction in person completely, those long periods of time. So this would be a balance of that. I just have concerns about those types of week on, week off, being that away from that building for so long with some of the plans that we've seen. So the amount of time would still be the same, but that's just something to keep in mind. I wanted to point out before we show the last option.
And as we adopted our calendar for this school year, and we talked about the built-in added minutes per instructional day, we have currently been on remote for the entire year thus far. How does that impact the number of hours that we're having? And if the state is clear to totally open back up without restrictions, let's say come January, how does that place us in terms of extra hours for inclement weather and the like?
We're still okay. We're fine.
Yes.
Okay.
Yeah, we're considering we're having remote learning right now. That's still considered your instructional time.
Okay.
And we have some buffers built in. So I don't think that's going to be an issue.
Okay.
Yeah, and I think that part of that discussion earlier where you combine the synchronous and the asynchronous, when you combine the work that the students are doing with the live teacher and then the work that they're doing without maybe on the recorded session or the paper pencil, and you couple those together, there are plenty of time.
And then the next option that we have is a conglomerate of all three.
Yes, so we have, part of what Dr. Mills shared was that once you pick one, then that kind of helps decide on what you can do for other areas. And so we're providing this option because this would be the option that would get the most students back in the building for our, all of our students. So we would have our elementary students on Plan A. And then because they would be on Plan A, and we would be able to do the single run buses, then we wouldn't have, I mean, because if elementary is on Plan B, like one of the previous options on option 3, then that's going to mean that there's going to have to be double runs, or we're going to have to send out lots of buses to be able to get those 22 students on each one of those buses. So if elementary is on Plan A, the social distancing is recommended, not required, whether it's in the classroom or on the bus. And because of that, there would not be the need for the 85 potential buses at the elementary. And then that would allow us to be able to serve the middle schools. And so those buses would then leave the elementary school when they finish dropping them off, and then go over and use that fleet of buses plus the middle school buses that would typically be, and then they would have to have a double set of buses going out to get them because they would be on Plan B. And then, of course, at the high school level, when we talked with our, like the staff and the administrators, it seemed to be that Plan C was the better option for the high school.
I will point out of the 4 options that you had that we presented, these are the ones that we feel like can be stable enough that once we start them, they can be maintained. There are some other options that you could look at that, again, the logistics of some of the transportation, we felt like once we start something, it needs to be predictable for families and parents and staff. So there are some other options that districts may look at. But for us, again, the logistics of transportation makes it very difficult. There's too many breaking points that could go wrong very quickly, and that will be detrimental to families trying to plan. So these 4 options, based on the information we have right now and the feedback that we have, would allow us to put them into motion and carry on. And again, you still have issues with the data that you have to consider from exposure and things such as that, that things could happen. But the last option would allow the most students to come back in to the setting. And one thing to consider with Plan A or Plan B in option 4 or in option 3 is that based on the feedback you've gotten from parents so far, you're not going to have the same populations of schools as we've had before. You're going to have some reduced density already before you start, because not everybody's going to send their children back in an A or a B. They may choose virtual, they may choose remote, and you've seen some of that. So even if we're talking about Plan A going back, the number's going to be reduced compared to what our schools normally look like. Now, that's not 100% predictable. People could change their minds, want to send their children back into instruction, and that's just something you can't lay out completely of what the pattern will be. But these are the plans that we feel like we've gotten the details laid out for us to consider enrolling, rolling out later in October.
The question has been raised at several of the options about parents who may be in virtual now and later decide they want to be in the face-to-face. Is there going to be a set window of time to allow for a change to occur for a parent to opt to either move into face-to-face or move out of face-to-face back into virtual or into virtual or remote at this particular juncture in time?
Dr. Wilson?
Yeah, we've had discussion in our groups about once the board has made the decision, then we will need to communicate with our families. Because again, we know that we just surveyed them at the end of September. We just got some the 21st through the 25th, but we know that based on your decisions today may change someone's mind. So even after the board has made a decision, we're going to have phone calls that will have to be made from the school level to say, this is what you've said on the survey last week or 2 weeks ago. Are you still interested in this option? Because there could be a family that said, you know, my situation has changed even in a short time.
Yes.
Or it could be as simple as someone down the street may have filled out their survey when they were talking to the teacher, and then the neighbor said, oh, well, I wish I had known you had said that. Then we could have carpooled together. Or I didn't think that I had that option. And so there could be some changes, and we recognize that. We will need to have that kind of turnover in short order. And when I say that, I'm saying within, say, 5 to 7 days, because until we get that information, we can't pass it on to transportation to get our bus routes together. And then from there, then we'll be able to move forward with that.
Madam Chair,
Yes, Mr. Breen?
I think I'm allowed a question, but, you know, really for the benefit of those following along at home, what do these plans mean for our parents that have students with exceptional needs?
Yeah, you may remember on the chart that Dr. Mills shared about the priorities, we're certainly very interested in. We have shared plans by the school level, but we are very interested in our students who are on the adapted curriculum to be able to return. That was one of the things that was mentioned in the July board meeting. There was a slide that talked about the staffing. Let me find that slide number. It's slide 47. So on slide 47, we did disaggregate that data for the EC adapted curriculum, and so that we would know if we had enough staff available to have those students.
So does it appear as though we do have enough staff for those students?
Yes, sir. We did have some who had some accommodations that they had requested. That will be up to Dr. Parker and his team to determine if that's going to be feasible based on their essential job duties. But certainly that's a high number of teachers who are interested in returning. And I think part of it has to do is when we surveyed the staff, the question was asked, would you be willing to turn with students? And when we couple that with the number of students who are actually returning in those populations, because we actually have the names of the students and those numbers that would be returning, it's not 100% of those students who would be returning. So there might be some teachers who would be satisfied with that limited density that would be there.
Thank you.
Yeah, we do feel.
Madam Chairman.
We do feel, I'm sorry.
Just
Mr.
a minute,
Farmer.
Mr. Farmer.
We do feel we can
Sorry.
respond to that, that particular curriculum in classrooms K-12.
Yes.
Mr. Farmer?
Do we have a specific date if we make a decision today on these options? And will we be meeting again based on data and the governor's directions with his phasing to go forward, or how is that going to work?
Based on the information that we have right now, phase 3 really doesn't affect schools. We said early on that we were looking at the first 9 weeks. So that's October 22nd is when we would start back. So it's very important for us to get direction. We've gotten input from staff and from parents, and folks need time to plan no matter what it is. And I know that remote is an option that's out there, but that's one that you've already are familiar with. So I think it's pretty imperative that we go ahead and get some direction so that we can plan again. Once this decision is made, then we've got to communicate it, we've got to clarify it, we've got to do all the logistics of routing, and then training. Our teachers are back, and that was part of the process so that we could begin some of that and see what pinch points we may have. But it's still going to be very tight to go to the 22nd. I mean,
Yes, sir.
I think, yeah.
Yes, sir.
Now,
Thank you, sir.
Yes, sir.
whatever this is this going to be conditional as we started out the year? We started out the year saying we would be in the remote and the virtual until the end of the first grading period. Is this looking at to the end of this calendar year? Is this looking at to the end of the academic year? What is the essence for decisions that we're making now?
Part of the issue is planning ahead. The other part is things could happen and the governor could roll back. The numbers could change. We've seen, school systems have to close schools for a period of time, as you do, and that could happen. But we feel like whatever we start with right now, we could continue for the rest of the semester, and that would give us some time to have data coming back. When I've had conversations at the state level in my RESA and in the superintendent's group I'm part of, folks are trying to make plans for periods of time that allow parents and staff to make arrangements. And so that's a global amount of time that has a fixed cut point that everyone can understand. And we're all hopeful by January, in a fresh semester, that it will be different. We know our seniors are very worried about what their school year may be like and their families. Our staff are trying to prepare. And so that's a natural cut point. So we have planned on this continuing for the semester. We feel like that.
Okay.
Because every one of these meetings causes everyone a lot of stress and heartache at home because they're planning and trying to know, but also because it takes a long period of time to come up with what seems very simple on the surface, but it is not. And we don't want to lay anything out that we can't sustain reliably. So we want to do it right and get it out there. And even with that, there's so many moving parts. Something's bound to happen as we go, and we'll deal with it. But these periods of time will allow us to look at the numbers, look at what's working, and hopefully by then, and again, our numbers, as Ms. Ellen was sharing, are positive, but we have no way of knowing what it'll look like in 3 months.
Right. Other questions? So I think you had a couple of other slides left to go. If you want to go through those before we continue.
I think those were actually reference slides if you needed them.
Okay.
And I don't think so. So just to recap for everyone here and everyone concerned, you have option 1, which is where we are right now, which is remote for all schools, all school levels. That's Plan C in the governor's nomenclature. You have option 2, which is elementary schools could go on Plan A, which would be, for us, that would go Monday, Tuesday, Thursday, Friday, and Wednesdays would be for extensive cleaning, thorough cleaning. Remote learning will be available, so our instructional time will be fine. Teachers have time to plan. We have teachers doing virtual, remote, they'll have doing face-to-face. I mean, they're going to need time to do planning, and it is a lot to do. They are doing a fabulous job managing all that. That takes a lot of time. And so that gives them a day as well. We feel very strongly about that. That's why it's not Monday through Friday as well. And then middle and high schools under option 2 would remain remote. Option 3, again, what you prioritize drives things. So if elementary schools are given precedence to go back in a alternating 2 days per week, and then the remote and deep cleaning there on Wednesdays, you'd still have middle and high school remote because of the transportation requirements and the logistical requirements with the distancing and the density that we would have under Plan B requirements, which is still an option, although the governor allows for A, you can still do that. And then option 4, which is elementary schools could go back under Plan A, middle schools would go back under Plan B, again, be in school 2 days a week, regardless of which group you were in, and high schools could remain Plan C until the end of the semester, and all these could be reevaluated prior to that time, and then you'd have time to plan.
Okay.
So those are your 4 options that we think are sustainable for the period of time based on what we know right now.
All right, members of the board, you've heard the presentation. You have 4 options before you. The administration has indicated that they would need to have time, and the families would need to have time, and time is of the essence. And we are already planning to be in a remote learning until the end of the grading period. And that grading period ends in about 3 weeks. So what is your discussion point in regard to what has been presented to you today? I think according to the crises, it says information, discussion, and action. So if the board wants to take action today, then we can do so. If we wait any longer, it creates a timing situation for families to know what's going on and anything else. So what is your pleasure? And let's open this for discussion at this point, please.
Madam Chair. I'm sorry.
I'm going to do alphabetical. Ms. Barnes, Ms. Boyette, Mr. Farmer.
I just had another question. I guess it piggybacks on what Mr. Green asked. And I think I'm correct in what I'm thinking. If we were to choose option 3 or 4, well, let's say 2, 3, or 4, we can meet our exceptional children's needs of getting them back to school. Am I correct?
Yes, ma'am.
For those students, right now, we're starting with those in the adaptive curriculum.
Say it again, Dr. Mills.
For those students we're starting off with would be in the adaptive curriculum.
Okay.
Yes.
Mrs. Boyette?
Thank you. I wanted to say I really like option 4. It has so many pluses, gets most of the students back. You mentioned how the bus runs would work. The consistency is there for the elementary schools where it's needed the most. Monday, Tuesday, off Wednesday, Thursday, Friday, every week. Plus, since we had such a high 65, what was the percentage? 64% of the middle schoolers that wanted to come back. It brings them back in as well, even though it does have to be on the alternating weeks. As you mentioned, once you prioritize one group, you have to make concessions for the other group. Plus, with the governor's recommendations, it would be impossible right now to do otherwise. But I really do like option 4, and thank you for that presentation. You've addressed all of the concerns that I had.
Okay, thank you.
Mr. Farmer?
I too want to thank you. Honestly, this is unbelievable, the work that's been done. I just can't imagine the hours. I want to look at it a little bit different. I think I speak for all the board members. Overall, we want to get them back as quick as we can, all of them, and we want to get them back safely. With that said, empirically, my main tenets are, and you've touched them, EC, I want to get them back as quick as I possibly can. They need the most help. K through 5, we know those kids basically are not carriers as best I can understand. So there's probably a great chance that they won't take it back to mom and dad and won't take it back to grandma. Third is staffing, and y'all have addressed that. And I'm so tickled that our people are willing to come back, but I want to make sure that those great teachers out there that do have underlying health conditions have a place. And then the most beautiful thing that you've offered is options for the parents. And I know that's tough, and it's going to be tougher as things go on. So I'm in agreement with Ms. Boyette. I like option 4. I am a little bit concerned about the middle schools. They are treated, anything above 11 years old is treated as an adult as far as being a carrier. But if we do it right, I think it's very, very possible. And we can put that many kids back in school, and we can learn a lot as we go. So I would say right now, option 4.
Other comments?
Madam Chair, you asked me, this is Velma Barnes, and I asked a question rather than expressing my opinion. And I do believe that, as Dr. Mills said, our parents really need to have predictable circumstances in our planning for this. I like option 4 as well. I believe our situation is stable but fragile, as the governor said. And if we're going to honor our parents in our surveys, it appears that option 4 would give us more satisfaction as far as parents are concerned, addressing elementary as well as middle school concerns.
Other comments?
Madam Chair,
Mr. Mercer?
I too, because of the number of students that would be served in face-to-face instruction, I too strongly lean towards option 4. And if I understand it, you said that it's sustainable. Dr. Mills, you feel like we can achieve it and we can sustain it. The only reservation I have is out of the needs we have, I don't want to take too big a bite and take any risk of having to back up, because we need to be moving forward towards getting all the students back in school. But I do not mind at all relying on the work that these teachers, administrators, and everybody has done, and being confident enough that it will be attainable and sustainable.
As you bear in mind with the options that are presented in the recommendation, that if we make a choice, that it would be through the end of the calendar year to the end of December.
Is
that correct?
Not the school calendar, but
the physical, the year calendar,
Right.
the 2020 calendar.
Right, yeah.
Basically the first semester.
Right, the first semester, which would
Mhm.
allow for reevaluation again and to see what the circumstances are as we move forward. What it seems to me is that with the comments that you're making, that you may be ready to make a motion if I am hearing
Madam
the
Chair,
responses. Mr. Breen?
I move that we adopt option 4.
Second.
It has been moved by Mr. Breen, seconded by Mrs. Boyette, that we select option 4, which would put the elementary students in 4 days a week, the middle school students in 2 days a week, the high school students to remain on remote. And this would be to the end of the 2020 calendar year with further discussion as we proceed and get closer to the end of the semester.
Yes, ma'am.
Excuse me.
Yes,
Now, and you referred to the exceptional children classes. That's
That is for the adaptive curriculum. We would be contacting those families.
okay.
so that's a discussion point. Any further discussion? Any other discussion? Hearing none, please record your response. Mrs. Barnes?
Aye.
Mrs. Boyette?
Aye.
Mr. Breen?
Aye.
Mr. Farmer?
Aye.
Mr. Mercer?
Uh,
Mrs. Powell?
Nay.
And myself, Dr. Fitch, nay. Let the record reflect that the motion carries 5-2, with Powell and Fitch casting the dissenting votes. And that was the agenda. So the chair will entertain a motion
Madam
for
Chair,
Madam
adjournment.
Chairman.
I heard Mr. Breen first, Mr. Farmer.
as per tradition, I'll defer to Mr. Farmer.
Okay, you've been deferred to Mr. Farmer.
Thank you. Madam Chairman, I move for adjournment.
second.
It has been moved by Mr. Farmer, seconded by Mr. Mercer, that we adjourn. Is there any discussion? Hearing none, please record your vote, Mrs. Barnes.
I'm sorry, aye.
Mrs. Boyette,
Aye.
Mr. Breen,
Aye.
Mr. Farmer,
Aye.
Mr. Mercer, Mrs. Powell,
Aye.
Dr. Fitch, aye. Let the record reflect that the motion carries unanimously. We are now adjourned.